Hello, I'm Sarah Stackhouse with Real News Communications Network, and we're talking to Dr. Johnson a little bit about sports injuries. We just had the Super Bowl, so I feel like this is probably a topic on everyone's mind right now. Dr. Johnson, I know this is one of the many things that you treat. Tell us a little bit about some of the procedures or phone calls that you might get about sports injuries.
Well, sports injuries occur in all types of forms. So you can have soft tissue injuries where you get bruises, strains, sprains, trying to heal those soft tissue injuries. Sometimes they're harder to heal than breaks. Wow. The bones heal quick. The high ankle sprains take a long time to heal those soft tissues. Yep. When you do have those, then you have musculoskeletal dysfunction where your back hurts with it, your neck, because it may have occurred with a hit in football or a fall in basketball or even a header in soccer. So
yep.
those things all occur. So how I look at it is evaluate what it is, then mobilize the restricted areas from an osteopathic manipulation standpoint, and then if it's not healing rapidly, we can use hyperbaric oxygen therapy, which is placing the person in a chamber like they do for the bends. A person breathes 100% oxygen. It delivers 10 to 15 times more oxygen to the tissues for rapid healing. So you can heal a third to a half times faster depending upon how much rehab you're doing with it and just how severe the trauma is, and get back to the sport quicker.
Yeah. I wish I had known about that. I played sports forever, and I would always kind of rush back and then re-injure that, or because that's weak, something else. How important is rehab and really taking care of yourself to make sure you're at 100%?
Well, it's important, and to get proper training is important too. So many people are just working for strength in one area, but you have to balance the body in your training. So if you haven't worked with a good trainer and you're doing fairly high intensity sports, it makes sense to get with one of the training facilities, see what they're doing, understand how to train to be healthy as well as strong in the areas you need to be strong in.
Yeah, so, and talking more about the hyperbaric chambers, is that something where it can work for a high ankle sprain, or is it just mainly head injuries?
No, it works for all types of injuries in the body. I mean, I've treated numerous basketball players for high ankle sprains, and they're hard to recover from. Yeah. And it takes quite a while, but it can speed it up dramatically. You work with it along with icing, rest, of course, physical therapy, and with that, then the recovery can be fairly quick. One of the things that just recently has been published and talked about is using hyperbaric with acute concussions. And the CDC publishes that 30% of people with concussions will still have symptoms after 90 days. The recent study that came out of North Dakota showed that in 50 students with concussions, using just up to 5 hours of hyperbaric, 90% were symptom free.
Yeah.
So what that means is you get oxygen back to the tissues. When you're in the pressure, it helps decrease the swelling, helps blood flow to it, and the healing is much quicker. Oxygen is the only thing we have in medicine that really enhances healing.
Wow. Okay.
And so when you put it under pressure, you fully saturate the blood vessel, just not the hemoglobin. And then you carry about 10 times more oxygen to those tissues that are injured, or to the whole body.
Right. I especially, like I said, with the Super Bowl just earlier this month, it's so relevant with the conversation around CTE with football players. I mean, what are some signs and symptoms you can look for in your child if you think they had a hard hit, or they, fell and conked their head, or whatever it is? What are some signs and symptoms you should look for, and what are some of the first steps they should take before even getting them to you?
Well, the first thing to look for the symptoms, so you document in your mind and confirm that they do have a concussion, and that is headache, disorientation, sensitive to light and sound, blurred vision, dizziness, and those are the main ones that are there. Just fatigue and lethargy is another. So if they have that, then they need to be assessed in the C, because if you hit your head hard enough, you can cause a bleed, a cranial bleed, and then that can mean death if it's not taken care of correctly.
Yeah. scary.
Yeah, it is.
Yeah.
And so you need to be aware of what's going on if you have a strike on the head.
Right.
Automobile accidents is another way you get concussions that are out there.
Everyday life, right?
Right. Particularly on the highways around here.
Yeah.
Then, if you want, after you get assessed and things aren't calming down, then hyperbaric makes sense.
Right.
The study that was done was they were taking them immediately within a day or two, using hyperbaric just 1 hour a day, and by day 3 to 5, most of the symptoms were gone.
Wow.
A lot of the students you talk to, well, they miss a week of school, they have headaches, they can't concentrate,
Right.
They're light noise sensitive, and those things are good signs that early on hyperbaric would be beneficial. And one of the things I'm doing here at the Hyperbaric Centers of Texas is to create a free program up to 5 hours of hyperbaric for kids, athletic kids that have had concussions that aren't getting better.
Wow.
And we're going to put together some data with that about their recovery, about how fast it is, how many hours it takes, so that we can get that information out there for more people to understand just how important it is to have early treatment,
Right.
And just not sit around in a dark room at home trying to figure out what's next.
We've piqued lots of questions in me. One is, if someone was having an issue, maybe for 2 months, is it too late to get hyperbaric treatment?
No, not at all. I mean, we've treated people years out from a head trauma or traumatic brain injury, that type of thing, and have good response. It's just with the athletes, they want to get back.
Yeah.
They want to do it safely. Well, some don't, some do. They just want to get back.
They want to get back on the field.
But everybody would like them to get back safely, and that's why they have all the protocols set up now in the high schools.
Right, which is great. So this program that you're doing, how can people find out more about it? And if they want to find out more about hyperbaric chambers and about you, is it a consultation? What's the best way to find out?
Well, the best way is to go to the website. It's Hyperbaric Centers of Texas. There's testimonials on there about it. There's information about hyperbaric there. If you want to see me, which one needs to do because they need a prescription to get into hyperbaric, then call my office at 972-479-0400. The front desk is well versed on the process. Those who had concussions, we get in right away, and so there's no wait, because the sooner you treat them, the quicker they get well.
Yeah, absolutely makes sense, and definitely sounds like a great step forward. Dr. Johnson, is there anything you'd like to leave people with here?
No, just be aware of if you are playing sports, you get hit in the head or have sports injuries, be aware of taking good care of yourself, paying attention to the symptoms, and if they're getting worse, be sure to get to see a doctor to be evaluated. And then for quicker healing, hyperbaric is there for you.
All right, Dr. Johnson, thank you so much.
Thank you.
All right, for Real News Communications Network, I'm Sarah Strackhouse.